Hi, welcome to the living room. This is season 1, episode 8. This is a show where we discuss real topics with real people having real conversations. On today's topic today, we're going to be speaking about the healthcare industry. That's definitely one of the big things going on, especially with, again, COVID-19. Hate to keep bringing COVID-19 into this, but healthcare has been an issue even before COVID-19 and hospitals being overwhelmed. There's been a lot of instances where minorities have a lot of issues with healthcare in general. Healthcare costs based off a lot of movies like what Michael Moore did, or with some of our news stations like ABC or CBS or NBC have put out there regarding people being denied care from their insurance companies. It's been across the board from each one of them. So I want to know what you guys think about our current affair of healthcare right now. Have you heard any stories that has recently been damaging to the healthcare industry? I want to see what your thoughts are.
Well, I have some statistics that I looked up. The U.S. spent about $3.6 trillion on healthcare, which averages about $11,000 per person. So healthcare costs are about 18% of the gross domestic product, which is up from only about 5% in 1960. So we have a very high cost of healthcare in the United States. And there's a lot of reasons for that. And it goes back to our conversations about capitalism. One of the main reasons is that Americans pay 4 times as much for pharmaceutical drugs than other countries, other developed countries. And then the reason that is because in other countries, drugs and healthcare are at least partially controlled by the government, where in the US, prices are dependent on the market. So it goes back to our conversations about socialism versus capitalism. We have a capitalist society where you have large pharmaceutical companies and healthcare companies that are making money off the healthcare, and it's one of the biggest money makers in America.
Yeah, and speaking of that, let me share some tips and facts with you that just to piggyback off of what you said earlier. This is going to be regarding healthcare in general. So this was, an article that was written by Investopedia, 6 Reasons Healthcare is So Expensive. And just to generalize this article, it was a lot of things dealing with hospitals and nurses charge more for their services. And there's a lot of administrative waste that goes on. Now,
Yes.
If you're talking about finances, it can always change or be something different, but it's usually something dealing with something going on behind the scenes. And so then that cost is then given to the people as well. And there was another news report from NBC News where they were talking about why they're so overpriced as well. And they said pretty much the same thing, is that like a lot of these doctors and nurses are a lot more expensive than it is overseas. So they charge more for that, and not only that, for the prescriptions and things of that nature. And it starts to get outrageous and become way too expensive. I think that when a lot of people are being denied healthcare, when they go into certain hospitals or things of that nature, it can be just kind of just a little over the top. So do you have anything that y'all want to say regarding that?
I mean, I definitely feel like the biggest issue is, the biggest concern is that it comes from the aspect of demand. With that being said, the 2 things that we will always need is education and health. So with those 2 being the main 2 things that we will always need as a human being to survive, those things are things that they will never fix because it's always going to be a recurring situation. From 1902 to 30,000, whatever, people are always going to need education and health. So with that being said, neither one of those areas are areas in which people want to fix or other governments try to fix. So I don't see them ever trying to rectify that problem. Take the average person who wants to be a doctor, wants to be a nurse. They get into the field because, number one, they know the pay. So to offset the pay, the medication, the visits to the doctor, the hospital, etc., it has to make sense. They have to make a profit off of paying off their staff, paying off employees, etc. So I get the aspect of why the fees are so high and the doctor visits and things like that. I get that aspect, but I do feel that there needs to be a better system in play for regular people just living life and wanting help. You get what I'm saying? And I feel that, until we figure, that's one of the issues that people have with the United States. Our healthcare system is so effed up. Like, you know what I'm saying? You can't afford to get sick. You know what I'm saying? You can't afford to be smart. And those are the issues. And we need to figure out a way to...
Come closer to the mic, because we can barely hear you.
We can't afford to get sick. We can't afford to be smart. You get what I'm saying? And that's a problem. We need to figure out a way to rectify that, and the government or whoever still be able to make whatever dollar amount they're looking for.
And just to say something about that as well, there is some hospitals that do some good work. This is from Health US News, very reputable source. And it seems like Mayo Clinic and Johns Hopkins are usually in the #1 and #2 spots for every single thing that happens. And so when I say, okay, for the level of care, I tell people, I say, we can spend all this money on jewelry and cars and all this silly stuff. Well, maybe you can spend, $10,000 on your health care. Maybe that's the reason why they're charging, because, you only have one life. So maybe that's one of the things that, people need to realize is that, you're trying to make sure that you keep your body in order and things of that nature. But when it comes to the level of care that everybody's getting, welcome back, Colleen. When it comes to the level of care that everybody's getting, I think that minorities are on the back burner. And so what gets me is that this was also from CNBC regarding minorities that don't get the same level of healthcare as white people. I want to see what you guys thought about it, because based off the report, Blacks and Hispanics often get less effective healthcare than whites. A new report finds they often get more unnecessary and economically efficient care. And while 5% of white Medicare patients with dementia receive feeding tubes, 17% of Black and 30% of Hispanics did. So it seems like, with the level of healthcare that we don't receive, it starts to become an issue. And I can speak to this recently because coming from Kansas, I normally see a lot of issues with how white doctors treat Black people. I went through that before. I remember when I had a stomach bug, and I said, please and thank you to my nurses, everything. This doctor who had a badass attitude the entire time, he was like, if you don't like our level of service, you can get up and leave.
Really?
And everybody, yes. And everybody was like, what? And I said, what are you talking about? I said, first of all, who are you? Oh, I'm your doctor. I said, no, I don't want you to be my doctor, because first of all, you want to part of this conversation, and I don't like your attitude. So I'd rather you give me another doctor. And I've experienced that a lot with a lot of white doctors. I hate to say it, this is the living room. We have to be truthful about things. But every white doctor I've had have not given me the level of care, or they think I'm made of bullets and they give me less treatments than other people that I know. I know somebody that goes in, they be like, oh, my arm hurt. They give them the highest dose of Oxycontin and opioids. They give all types of x-rays and scans. And I'm just like, really? I said, I can go to any doctor and get that same level of care. And I see that there's been a lot of news reports come out recently about Black people dying in hospitals or that work there. For example, this is how I know what I'm saying is true. There was this woman who, and I'm going to share my screen with you guys real quick. She had worked, and I hate that this thing pops up like that because you can barely see your screen. But this was a Black nurse, and she had worked at this hospital for approximately 31 years, they said. Black nurse in Detroit died from COVID-19 after being turned away from hospital 4 times. She works at this hospital, and she didn't receive the care. And this is at Belmont Hospital in Farmington Hills. They need to be put on notice, because I do not believe that treating based off the color of their skin, it should equate to having good care. And my dentist, I never have problems with my dentist. It's usually the doctors, and it's usually white. And that's why I hate to say it, I usually try to go for a minority doctor, because one, they don't usually get the business, because there's a lot of racist people that say, oh, I don't want no Black doctor, so I'll give them my business. And then the other thing is that when I go to minority doctors, and whether they're Asian, Hispanic, whatever, I get a different level of care than I do from white doctors. What do you guys think?
I can personally say, I wouldn't necessarily say I get a different level of care. What I will say is that the Black doctors that I've interacted with, they're a little more interactive and they're a little more understanding in regards to certain aspects. But why did the woman go to the emergency room? I'm just curious about that.
She got turned away 4 times.
Because the emergency room takes anybody. You have to
No.
show.
She had symptoms. Yeah.
Yeah, like the emergency room, they'll bill you, but
been-
you have to take them if they go to the emergency room. But
Mhm.
what I will say is with Black doctors that I've noticed, Black doctors, if whatever the procedure is, if you don't have the money up front, they're willing on working with you in regards to payment arrangements and things of that nature. White doctors, big corporation doctors and things like that, they're not willing to do so. It's very much, do you have insurance? Can you pay the fee? You know, but Black doctors, they'll work with you a little bit more, a little more personable, and they're a little more understanding in regards to your financial issue, in regards to getting whatever your issues resolved.
So do you think people should go to doctors that are more relatable to them?
I mean, I think at the end of the day, it depends on the person. You know, if you financially have the money to spend whatever, you can get whatever treatment you need, that's perfectly fine. But for the people who can't, like you get what I'm saying, the minorities and things like that, you definitely need to find doctors who can relate to whatever you have going on financially, whatever it is. You get what I'm saying? Because at the end of the day, I shouldn't have to deal with an illness or whatever because I can't financially afford to get it treated or fixed or whatever the circumstances.
So you're saying it's not a race thing?
Because you're in
again,
Atlanta, so you have a lot of Black doctors. So it's hard for you to like kind of compare.
Relate a little bit? Because here in LA, and even like, I mean, I've never been to the South and lived there, but here in LA, for example, there's a lot of that, what Chris just said, where you go into a hospital, you go into your clinic, and they basically, if you're Black or brown and the doctor is white, they look at you differently. I had an experience myself, like if I felt like, and it wasn't even something that he said, it was more like the energy. You can sometimes feel more of the energy than the words that they're coming out of their mouth. And I felt like I wasn't really like, he wasn't listening to what I was saying, you know, and I felt like he was looking at me, I was dirty or something. And so that you know, and I now have a Black doctor, and I feel like, well, I live in near Baldwin Hills, what they call it the Black Beverly Hills, and then I feel like he can I can relate more to him in a sense that he understands where I'm coming from. Like if I explain to him, you know, some health issues or whatever, like he's more willing to listen to me. So, and I feel like he's more knowledgeable. And again, I've never been to Atlanta, so I don't know the population as far as doctors there, but I don't think it has anything to do with, you know, the economics. Like if you were to go to a doctor and the doctor is racist, period, you're just a brown or Black person to them. It doesn't matter how much money you got.
Yeah, I think that there's institutional racism in the healthcare system, but I think the economics does play a big part on it. We have a public health system, and then we have a private health system. So an example in Atlanta, Grady is a hospital and a system that caters towards a lot of poor people, working class people, and they have a very good public health presence. And you have Emory, which is on the opposite end, which caters more to the private sector. So I think the economics does play, but then the racism also is there. So when you have minorities who are also, and which is mostly the fact, you know, who are on the poor end of the spectrum, then we are going to get treated, you know, just unequally. And that's been evident by this COVID-19 pandemic. Most Black people have been at the forefront of being gravely ill and dying because we have underlying healthcare conditions that haven't been taken care of or alleviated over the years.
And I mean, think about it like this: how many Black people?
We're running out of time. We're running out of time. So I'm sorry. This definitely will be another discussion talking about healthcare industry because we can't fit this all in one topic. Well, actually, in one episode. But there's so much that's going on that needs to be fixed for our healthcare industry. There's a lot of work that needs to be done. But speaking of the healthcare industry, we're going to stay on it real quick for a little bit. We're going to talk about our company, product, and sponsor. Well, not sponsor, but company, product, and service of the day. And we're going to go speak about Derm King. Now, Derm King is in Los Angeles, California. That's everybody keep asking me like, who do you get your face done with? Who do you get? How's your skin so clear and everything? Well, it's this guy right here. Now, this is his website right here. Dr. McCarroll. Landon is the one of the doctors. Well, he's the only doctor in there, but he has a very nice facility, very professional. Every time I have an appointment, is made on time and correctly. And if this internet don't come on, there we go. This is his website right here.
Face?
Yeah, and his face is like clear and amazing. And so he does a lot of lasers on my face, electrolysis stuff on my face. I also use his products called Imprint. And also the reason how I found him, because I told a friend, I said, hey, who's Angela Bassett's dermatologist? And he looked him up, and this is him. And so he does biblical box, as you see right there. This is Angela Bassett. He has a lot of photos with Angela Bassett. It's right here to the left. So it was funny because when I went in to get a treatment this past 2 weeks, she said, you just missed her. She just walked out the door. I said, oh my God. I was supposed to meet Angela Bassett, and I didn't get a chance to meet her. But he does very, very good job. And what I like about him is that he does not only just work with white skin, he also really specializes well on black skin. And so that's why I feel trusted with him, because, a lot of people, speaking about the healthcare industry, when it comes to black and white, it's just like people are used to being around one group of people, that when they get around another group of people, they don't know how to do it. He does everybody. Hispanics, blacks, white, you name it, he does everybody. So I am really proud to be going to Derm King. This is another one of his patients who he cleared up his face. But he does a very good job, and you see it really cleared up. But he has some amazing products, and I would recommend that people go to Derm King. He's in Los Angeles, California. This is an imprint collection right here. I apply this to my face every day. This is the face wash. To the left is the two moisturizers. Well, this is a moisturizer, and this one's a moisturizer. And then he has a sunscreen where it blends into black people's skin, which is amazing. But not just black people's skin, it blends into everybody's skin. So I would recommend that people go to his website, book an appointment with him. If you're serious about your skin, you're serious about it being healthy, you want it to look, glow, and be radiant like how mine is glowing right now, then he'll get it done for you.
Derm King too, because I started using that recently, and I got the sunscreen, and that actually has helped me a lot as well. Protecting my face, because I started getting marks on the side of my face because of the sun damage, and I'm going to start some other treatments too. So I'm looking forward to just sharing those results.
Awesome, awesome. So what we're going to do is, I think it is my turn to share a photo or a video of today, and I am trying to get to my Facebook and having a hard time getting to it right now. Give me 1 second. You know how it is when you're online. Your internet just goes all out of whack and everything, but that's why I'm glad that we're still able to do this show and get it done. But yeah, he Dr. Landon is pretty good. And I am really trying to get this photo up right now. Give me 1 second, you guys. I do apologize. So this is the photo and video of the day that I wanted to share. I am going to share it with you guys right now. Let me know when you can see my screen. So this photo and video of the day right here is all the black people who have been killed unarmed.
Oh, I saw that.
All of them. And if anybody can sit here and say they can justify all these people dying over, I mean, it was stuff, and this is what gets me. It's just stuff that I see all the time with, I hate to say it, racist people out here who are always saying, oh, they did something wrong. I said, well, I can show you videos. I've seen a video just recently. There was these two white guys beating the hell out of these cops in the police station. Not one taser.
Wow.
Not one gun. Not one dog. Not one baton was sticked on any of them. They was fighting them just like it was a regular school fight. But you mean to tell me these people can get shot in the back? These people can be shot playing video games with them. These people can get shot in their car. These people can be shot playing with their kids. So if anybody can justify this and stuff, you stick in the head. I'm just gonna flat out say it right there. So
you're right, and we have to note that this is just a fraction of the black people who have been killed who were unarmed.
Yeah, absolutely.
It's a small representation, but yes, very sad.
Yeah, so this is my photo and video today. So that concludes our season 1, episode 8 episode. Tune in next week when we discuss real topics where real people having real conversations. Tune in next time and you have a good day.
Thank you. I know.
Hi, thanks for watching The Living Room. If you like what you see, please like, share, and subscribe to our YouTube, Twitter, Instagram, or Facebook pages. In addition to that, if you feel like you would like to be a co-host on our show, please make sure to submit your audition tape to thelivingroomtvshow.com, or you can also submit it on one of our social media pages. In addition to that, make sure to submit your audition tape and the reason why you would like to be on our show. We'll see you next episode. Have a good day. This episode of The Living Room is sponsored by Juiced Up, Way Smoothies on the Go. Juiced Up is a California-based company that offers smoothies and acai bowls on the go. The company accepts deliveries, and you can place your order by going to their Instagram page at JuicedUpAF, or for more information regarding the products, you can go to their website at www.juicedupaf.com.